Brandee Rada-Burns, and this is my AVMA task video for large animal management, VTHT 2325, and my ID number is 3302190. Okay, so I'm going to demonstrate how to halter, lead, and tie a horse. So I have her halter right here. Take both sides, slip it up over her nose, lean this over the top of her. I'll make sure that I get this up snugly. Okay, babe. Go ahead and buckle that. And then when I'm leading her, I want to make sure that I have the rope in my hand like this, so that if she does bolt for whatever reason, I don't have the rope wrapped around my hand and she was to like injure my hand. So we'll go ahead and lead her. Come on, Ollie, let's go. I'll go over to this fence while I'll demonstrate how to tie her. Okay. That's how I would go ahead and tie her. And then if you can just go ahead and get right out of it. Okay, so now I'm going to demonstrate how to apply a twitch to a horse. So Holly here, I'm going to go ahead and just kind of desensitize the area by squeezing it. And she probably hasn't been twitched, or maybe a couple times, so we'll see how this goes for her. She's an old lady, so she kind of likes her way, huh? Okay, come here, Mama. So we're just gonna go, I know. Come here, Hall. Come here, Hall. So we're just gonna go ahead and put her lip into this area. I know, hold on. Once we got that, we're just gonna go ahead and spin, twist, twist, twist. Oops, hold on. Come here. I know, you don't have much lip there. Okay, and that's how we would twitch a horse. Good job. Okay, so now I'm going to apply a tail wrap to Holly's tail. I'll start at the base of her tail. Go ahead and do 3 secure wraps. And then going down, I'm going to take a little section of her hair, twirl it, make a loop like so, and then do the next layer. Down a couple inches past her vulva. Like so. And that's how I would do a tail wrap on a horse.
Recording.
Okay, now I'm going to demonstrate how to do a leg wrap on an equine. So I have my padded layer right here. I'm just going to go ahead, start right here, and I just want to make sure that it's as even as possible. And I don't want any wrinkles or anything like that in it. Okay, and then I have my other layer right here, so I'm just going to tuck it in a little bit on the inside of the cotton layer, and I'm going to start in the middle. Oops. With this, I also want to make sure that there's no wrinkles or anything, and I want to do it snug but not too tight. And I'm going to go down You're okay, Hall. You're okay. Whoa, 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 whoa. I'm gonna work myself back up. Good girl, Hall. I know, Mama's good girl. And we're gonna head back down towards the middle. And I have a Velcro area. I'm just gonna Velcro it across. And that's how we would do a leg wrap on an equine. I'm gonna demonstrate how to do some distal leg radiographs on an equine. So we already have our patient up on the block. We're gonna go ahead and shoot a lateral first. So I'm just gonna go ahead and put the plate there. And you want to be 32, great. We're gonna be 32 from the plate. Okay, and then I have my KVP set at 64 on our X-ray machine. And we're gonna shoot. Okay, so now we're going to do an AP radiograph. So I'm going to go ahead and set my plate. We're going to do 32 again.
Sure, okay. They look good.
Fly spray now. Okay, we're still at a distance of 32. We're still at 64 kVp. So I'm going to go ahead and shoot. Shooting. Okay, now I'm going to administer a medication internally. She's not on any medication, so I'm going to give this water by mouth via oral syringe. So we're just going to lift up her lip. Good girl, good girl. Go ahead and just put it in the corner. Good girl. Good girl, Holly. And that's how we would do that. Okay, so now I'm going to demonstrate how to do a jugular venipuncture on an equine. So I'm going to go ahead and clean the area. I have some gauze squares with isopropyl alcohol on them. Basically, I'm just cleaning the area until there's no more debris that shows up on the squares. You're okay, babe. One more. Okay, so now I'm going to take my 3 ml syringe with my 20 gauge 1.5 inch needle. And so I'm going to go ahead, occlude my vein. Good girl. Good girl. Woo. Okay, and that's how I would draw blood from a jugular of an equine. Okay, so now I'm going to demonstrate how to give an intramuscular injection into her gluteal muscle. So I'm going to go ahead and use some gauze squares of isopropyl alcohol just to clean the area of any debris. I don't want to introduce any bacteria into my injection site. I'm going to do a couple scrubs of this. Okay, and then I have a 3 ml syringe with 1/2 ml of saline in it that I'm going to go ahead and give her. And I have a 20 gauge 1.5 inch needle. So I'm just gonna go ahead, take that off, do a quick poke, draw back, make sure there's no blood, and then give it. That's how I would give a intramuscular injection to an equine. Okay, so now I'm going to demonstrate how to give an intravenous injection. I'm going to use her cephalic vein right here. I'm just going to clean the area from any debris. I have a 3 ml syringe with some sterile saline in it, about half a mil. I'm just going to go ahead, occlude the vein, quick poke, pull back, and then give it. And that's how you do a intravenous injection on an equine. Okay, so I'm gonna do a temperature, pulse, and respiration on Holly. So first I'm gonna auscultate her heart and lungs, and then I'll get her respiration rate. So I'm just making sure that I'm listening to all the quadrants of her lungs, listening for any wheezing or crackling. I'm gonna listen for a couple breaths. I know, good girl. I know, big sigh, huh? You're a good girl. Okay, now I'm gonna get her respiration rate. So her respiration rate is 32 breaths per minute. I'm also gonna listen to her heart. I know, Hall, I know. And her heart rate is 48. I'm gonna go ahead and listen to her other side as well. Check on those lung quadrants. Good girl, Hall. And I'm just doing the same thing, listening for any abnormal lung sounds, and I'm listening for a couple breaths on each section. Okay, everything sounds good with her lungs. I know, mamas, I'm sorry. Next, I'm gonna go, can you get back? Back, back. Good girl. Next, I'm gonna go ahead and get her pulse. I know. She's like, what's going on over there? I know, baby girl. You're okay. Okay, and her pulse rate is 40 today. Last, I'm gonna go ahead and take her temperature. Okay, so I'm gonna go ahead and move her tail out of the way. I know, mamas, come in. I know, mamas, I'm sorry. She's like, what the heck? What the heck, huh? You're a good girl, Holly. I know, I'm sorry. Stop. Okay, and her temperature is 99.1 degrees Fahrenheit. That's how we do a temperature, pulse, and respiration on an equine. So now I'm going to perform a California mastitis test on a dairy cow. So he already sprayed off the teats for me, so I'm just going to go ahead and clean them off. Making sure that I'm getting all the way down to the end. Okay. Go ahead and take my paddle. Go ahead and express the foremilk. Okay, so then I'm going to go ahead and put some reagent, swirl it around. So then by this test, it looks like she does have some mastitis in her back left teat and potentially in her back right teat as well. So that's how we perform a California mastitis test. Okay, so this will be how to demonstrate how to operate a cattle chute. So the cow can go in, this will stay lifted. Once the cow goes in, then I can go ahead and shut it. So, their head will come in and squeeze this, but if I need to make it any tighter for any reason, I can pull this in and get their head tight in there. If I need to release it for any reason, that way, like so. When the cow comes in, their head will get stuck first. And then when that is done, I can go ahead and squeeze them in like so. That's how we would operate this cattle chute. Come on, put your head through. Let's go.
Just open it up just a little bit.
Come on, let's go.
No.
Which way?
The other way. Hey, you want to squeeze them up?
Come on. Let's go. Let's go. Okay, and that's how we would get a cow in a cow chute. Okay, so now I'm going to demonstrate how to put a head halter on a heifer. So this part will go over like this, flip it up behind the ears. I'm going to go ahead and cinch it right here. Okay, and then there's a little loop right here so that I can put a lead rope on and lead her around. And that's how we put a harness on. Okay, so now I'm going to demonstrate how to do the tail restraint. So I'm just going to grab the base of the tail like so, twist it up like this. That's how we would do that. And then if I wanted her to get out of the squeeze chute for whatever reason and she wasn't wanting to go, I can go ahead and push this forward and it will tell her to go forward. But that's how we would do a tail restraint. Okay, so now I'm going to demonstrate how to give medication or an oral solution via a dose syringe. So this heifer is not on any medication, so I just have water in this dose syringe. So what I'm going to do, get as far back as I can, and just squirt it in there. I know, good job. Okay, so now I'm going to demonstrate how to give medication via a balling gun. So this heifer is not on any medications, but I'm just going to go ahead and use her as an example. So I would have a bolus or a tablet here in the tip pulled back. And so what I would do is just go ahead, stick it on in there like that, and then just shoot it in there. That's how we do that. Okay, so now I'm going to get a temperature, pulse, and respiration on this cow here. Okay. So I'm going to go ahead and listen to her lungs first. Listening for any wheezing or coughing. Okay, now I'm going to go ahead and get her heart rate. So her heart rate is about 40 beats per minute. I'm also going to get her respiration rate. Respiration rate is about 24, and then I'm going to go ahead and listen to her lungs on the other side as well. It's okay. Again, listening for any wheezing or crackling of the lungs. Her lungs sound normal. We'll go ahead and get her temperature as well. And her temperature is 99.8 degrees Fahrenheit, which is normal. Pump the pulse at the coccygeal artery. So I'm just going to place my fingers back here and count for 15 seconds. So I'm going to go ahead and start my stopwatch. Okay, so that pulse is about 45. Okay, so now I'm going to demonstrate how to draw blood from the jugular vein of a goat. So I have an alcohol pad. I'm going to go ahead and in the area. I have a 3 ml syringe. Good job, honey. Okay, and that's how we draw blood from the jugular vein of a goat. Okay, so now I'm going to demonstrate how to give a subcutaneous injection on a goat. So I have some alcohol pads. Go ahead and clean the injection site. And then I have a 3 ml syringe with sterile saline, about 1 ml of sterile saline. So I'm going to go ahead and tint the skin. A quick poke. I'm going to pull back, making sure that I'm not in a blood vessel of any sort. And go ahead and give it. That's how we would do a subcutaneous injection on a goat. Alcohol. I know. Hold on, baby.
Does someone want to help hold the foot?
It's fine, I got it.
Got it?
And I got a 3 ml syringe. Hold on, Agnes. Okay, and that's how you would give an intravenous injection to a goat. Okay, so now I'm going to demonstrate how to clean out a stall in a barn. So I have some feces right here. I'm just going to go ahead and use the rake and scoop it up. Then the wheelbarrow here. Okay, and then when all the feces is scooped out of the stall and the wheelbarrow is loaded, then we would go dump it where it needs to be disposed of.